Good morning, guys. This is Dr. C. What's cracking? How to build a multi-million-dollar practice. How to build a $1 million practice. Well, the first thought I have to say is, what's $1 million now? Is that a lot of money? Nope. Can you retire on $1 million? Nope. And as doctors, when we grew up, I remember when I was a kid, $1 million was a ton of money. Wow, Jesus. Now it's not. What's changed? Can you retire on $1 million? Nope. So $1 million practice today is really not a big practice as it used to be. Okay? And doctors are like, what? Really? Yeah, well, everything's escalated to the next level. Everything in dentistry is escalated into the next level. Back in the day when I was a kid, you'd have your general dentist. They do crowns, bridge, fillings, fur everything out. You had your prosthodontics doing some of the advanced stuff. You have all these specialties, everybody's happy. Nowadays, the whole world has changed. So let's just talk about how to build a $1 million practice and how easy it is. I see this video may not be for everybody, but, I'm specifically talking to like the guys that are doing bread and butter dentistry. You do your filling, you do your crown. I don't like root canals, so I refer those things out. I extract, but I don't graft. I want to learn how to pack powder, which is about a 30-second procedure and makes you a ton of money. No, I don't want to learn anything complicated. Okay, well then you're going to always have a certain style of practice, and you're going to have to market the hell out of it and do a ton of patients, accept a bunch of insurances to reach that goal. So the first thing, if you kind of think about, is you step back and learn about, as a doctor, what kind of procedures do you sell? You got to do a lot of fillings to do $1 million. You got to do a lot of crowns to do $1 million. All right? So you see, get my drift? So I think the first thing that I like to say is the problem with practices that haven't reached $1 million. The first problem is the doctor. Okay? And unfortunately, that's the case. I see doctors who's like, oh, no, I know how to do an implant. How many do you do a month? One. Man, you probably don't know how to do implants effectively to do larger cases that are actually expected these days. That general dentist can do. Because no one's referring to prosthodontics anymore. Nobody wants to go to that residency. Even the residencies have changed their programs. And what is the market changing to? You got more patients that are needing extractions. You have more patients that are needing full mouth. You have more patients that are needing a lot of different exciting procedures that a lot of dentists are overwhelmed when they see and they don't know how to do. So they just back off and they're like, oh. Well, you got to kind of get over it and grab the next 10 years and learn how the market's changing, because the next 10 years for GPs are an amazing time. So let's get back to how to make $1 million practice. There's two types of practices that are really reaching these goals really easy. You got the one, clear choice models. Okay, let's talk about that. All right, not a bad model, whatever. Those are big cases. The procedures they sell are 50 grand cases. Boom, boom, boom. They market a ton, spend a freaking ass load of money. They get a bunch of patients in. 50 grand, no. 50 grand, yes. 50 grand, no. 50 grand, yes. All right. So if you're doing you close 4 cases at 50 grand a pop, it's 200 grand a month. That's $2.4 million a year. Easy. Now, that can be an overwhelming style of practice, especially when you only have one trick pony, like doing hybrid overdentures that they do. So I don't really recommend that to my students. Okay. What I recommend is if you have a $700,000 practice right now, $500,000 practice, $800,000 practice, I like these practices that have good hygiene departments. You're doing good bread and butter. You're doing your fillings. You're doing these cases. And then I'm saying, okay, that's the artery. That's what keeps the lights on. You guys are doing okay. You're still struggling a little bit. And then you add on some of the bigger stuff that you guys all should be doing. Now, I'm not saying you have to get into the opening bites and crazy stuff, okay? Even though that's not that hard. But you should be able to do some denture cases with implants, right? So, what is an overdenture with 4 implants, up, top, bottom, with extractions usually cost? About 25 grand, okay? So if you're extracting teeth upstairs, grafting them, putting 4 implants, you're doing the same thing downstairs. You're putting in the temporary dentures for the patient. 8 weeks later, you're putting the overdentures on with locators. That's 25 grand case. You do 4 of those a month, there's 100 grand. You add that on top of an $80,000 a month practice, you're at $180,000 a month. Wow. Now, how hard is it to get those cases? Dude, denture cases? Dude, you're coming in like sardines. But the cool thing is if you start learning some of the other procedures with the denture cases, most people don't want dentures. So if you offer them alternatives, you can start doing some of the really, really cool cases. So my main point right here is you take a general case, a general practice, and you stick my ass in you, I'll pop that sucker over to $2 million any day of the week and twice on Sunday. Because you take what you've got and you add a few big cases, boom, you're set. All right. So I like that approach. And that's where a general dentist can start building their skills, and they're going to start seeing their revenue start to spike. And, getting those bigger cases, you don't have to start doing these clear choice marketing campaigns where you're spending $40,000 on TV. But you've got to have some kind of external marketing to be able to grab some of the patients that are losing their teeth or having problems. So even the people that do want to do dentures, then the first thing I always see young graduates do is like, I'll get into veneers. All right, so learn Smile Designs, do some veneers. But right now, even there, you're handcuffed because a lot of those veneer patients 20 years ago that just came in for a 10-unit set of veneers want a 10-unit set of veneers, but one of the teeth are broken and you need to be able to do an implant. So how do you do a veneer case with one implant all at the same time, smile makeover it, and even have that? And that's not too hard. And that's a $15,000, $16,000 procedure. See, so when you get into business and you start learning how to pop a general practice, when you're offering $10,000 to $15,000 procedures or $20,000 procedures, and we can go into restorative dentistry all day long, that's kind of how you are able to raise that bar competently. And I have doctors say, "Oh, I'm already trained with implants." Yeah, you may be able to do one at a time, but you're not fast enough to do 4 at a time, up, 4 at a time, low, get it all done that the patient needs to do, and be able to do it competently and effectively. You'll stage it because you're not fast enough. And that's why I'm in a Simply Implant Institute, and that's what we train. People are saying, well, you're really into full mouth reconstruction. No, Simply Implants Institute, we will take you to the journey. If you want to learn full mouth, we'll get you there. But even if you just want to be able to have a really clear understanding of getting into implants and learning how to do them quicker, faster, effective, and learning also where to place them. Ooh, that's kind of a cool question. Where to place implants? Well, how do you know where to place an implant? You got to know what the restorative components are before you can even place an implant. So what I like to do is in our courses is to really combine a restorative driven approach. You got to know the backbone of restorative dentistry, from arches to full mouths. What are the products available? How to, at least to understand what they are. I had a student that got into implants that doesn't want to do some of the harder cases, but he's like, dude, that wasn't as hard. I'm like, cool. Well, he doesn't even want to do some of the implants for the harder cases. Not a problem. Totally get it. But now he's competent enough to work with a specialist in order to tandem it, and that popped his practice up. Okay? So why I wanted to do this tip video today is all those doctors that are watching this video, look at what you sell in your practice. Look at the procedures you sell in your practice. That's really, really important because more people are needing extractions. More people are searching for full arch opportunities. This week alone, I had 9 consults. 9. And they actually came from my denture marketing campaign. Now, you would think that every person walking in, they're coming in for denture, right? It was actually from a denture mailing piece that I do every month. And so I had 9 this week. So 2 of the 9 came in and they don't need dentures. But every tooth in their mouth was really badly, needing some help. But they were wanting to come in for a solution, so I gave them a solution. So we actually kept all their teeth. There's 2 of those patients in the 9 are no implants. We just need crown and bridge. But we need it done at one shot. No implants. 2 of them. 2 of them were denture cases. And those patients chose 4 implants up, 4 implants low with dentures, which is a great product. It was $25,000 each. Whoa. So you did 50, 50, 25, 25, $150,000. Okay. Now the other ones were bridge work on implants, FP1s. We had a couple regular hybrid overdentures, which is the all-in-4. Those weren't actually too bad to do. And we have those getting loaded. So you can see if you do 4 patients, even at a lower 25, 25, 25, 25, that's $100,000 added onto your practice explode. Even if you're at $70,000 a month and you do one of those cases, you're now at $1 million practice. So the reason why I'm doing this video is because you guys need to kind of step outside the box and say, what do I need to learn procedure-wise to be able to be competitive in this market in the next 10 years? And this is the way the market's going. So that's how you build $1 million practice. That's my suggestion, and that's what we teach here at Simply Implant Institute. So, guys, grab a course, go learn it, learn how to be proficient at it. You know, don't think that if you've taken one weekend warrior class, you've done 1 or 2 implants, and you've done 1 every month for the last year, that you're proficient. And just, if you want to do it slow, just work on your speed. Work on your speed, work on your skills, work on your skills. But also do not forget the restorative components that are necessity to learn when you're doing these cases. And you guys will be very, very successful. And I don't care where you're around the country, all the patients are needing these kind of options. And whether they take that option or not, I don't care. But at least I'm going to give them all the options that are available, you know, for them when they come in and actually see us. So anyway, guys, have a great, happy holiday and take care.